In my view, we need to understand the positive values, the qualities, the abilities that are associated with traditionally masculine culture and truly respect them and truly value them and not act like they're irrelevant to us, because we are all going to be increasingly reliant on the people who are able to rescue us from what's going to be happening.
Dr. Dan Bilsker, PhD, is a psychologist with a focus on men's mental health. He is a clinical assistant professor at the University of British Columbia and an adjunct professor at Simon Fraser University. In addition to his published academic research, he has produced several mental health self-management tools, including the Antidepressant Skills Workbook, which is available in numerous languages. Dr. Bilsker, it's a pleasure to have you on the podcast.
Oh, thank you very much. It's fun to be here.
Excellent. So I know that you've participated in some cafe events in the past, speaking usually about mental health for men. So I want to take the next hour or so to go into some of the issues that you've already spoke on a little bit more in depth and explore some of those. And that can include suicide, depression, resiliency, coping, and a few others. So if that works with you, then we'll get right into it.
Excellent.
So I want to start with men's mental health in general. And when we look at it from a gender lens, it seems to follow some patterns that may be different from women's mental health in terms of the issues, problems, or challenges that men face and their strategies and techniques for dealing with them. So can you tell us, in your experience, when men are facing issues, how are those sometimes different from the issues that women face? And what are the differences in how they deal with those issues?
Well, the literature on men's psychological suffering, which is really the right context for it, rather than talking about these medical metaphors of illnesses and so forth. So when the literature talks about how it is for men psychologically, they say, well, men come out as having relatively low rates of clinical depression in our diagnostic system, far lower than do women, and yet men have much higher rates of suicide death. 80% of suicide deaths are male. Therefore, a lot of the literature says there must be something different about clinical depression in men. It must manifest differently or show up differently. And some of the literature says that men, when they're suffering a clinical depression, are more likely to show something like anger or aggressive behavior as an expression of their suffering, while women are more likely to show sadness or a sense of isolation, etc., in their experience that is very painful to them. And they say men obviously are having the same amount or even more clinical depression, but it's manifesting differently. I find that kind of illogical. They have these diagnostic systems like clinical depression with all these criteria specified, and that's what it's defined as. If men don't meet those criteria at the same rate, you can't say they really have it, but it's manifesting differently. It's not logical to me. There's a real limitation of the whole clinical diagnostic medical model system itself, and it does, in this case, a poor job of describing or matching psychological suffering in men. And that's really what we're talking about. We're not talking about men catching the illness of depression. We're talking about men suffering psychologically, men in despair, men in hopelessness, men in loneliness. These are the kind of concepts that are most relevant to understanding what happens for men and how our medically based system does a very poor job of identifying their suffering or supporting them or responding to it. We don't do that well with men. Men are in some ways blamed for this. They say men don't come for help. They just don't show up. They don't reach out for help. If they did, there'd be all this wonderful help for them. I'm not convinced of that. I think we need to change our approaches, our interventions, the way we approach men and support them and work with them. We really need to develop some new approaches. And I don't think it's going to fix the problem to somehow lure men into the system, convince them, persuade them to come into the system where they can be receiving medications, etc. I think we're missing a lot of the point, as we often do. I worked a long time in the public mental health system, and I know that we often miss the point in general. And it is fascinating, looking back on my work in emergency psychiatry, that there really was no differential approach to men. There really was no gender lens in the services we offered. We didn't actually notice or identify the fact that men were killing themselves at a much higher rate. We were mainly seeing women in terms of depression in our system, and that something was happening, that we weren't seeing men, that they were dying at this really high rate, that maybe they needed different approaches, unique approaches to dealing with men, reaching out to them, wasn't really part of the thinking in the system. And yet it's been widely known for a long time that men die by suicide at a much higher rate than do women. And yet very little has been, in my experience, made of that. Very little response to that. Remarkably little research. So there are different patterns that men have for psychological suffering, for experiencing or for communicating or showing their despair, which really need to be understood and differentially approached, and men need to be brought into support systems in a different way than we've done till now. Diagnostic categories, the medical system, the disease model, it just isn't working very well. It's failing in this regard. The sense is that for men, now what I do is I think of this as male culture. I think of this as a cultural difference between men and women. Men are raised within a certain kind of set of cultural expectations for their behavior, for their emotions, for their choices, for their risk tolerance. Men are given a number of different expectations, and it really, to me, is most meaningfully understood as a culture. So, within male culture, psychological despair and deep suffering may be experienced as a kind of sign of acceptance. You say nothing about it, you just deal with it stoically. It may be experienced as anger and rage and bitterness, sometimes still kept inside or just evident as a kind of a poisoned reaction to the world, a sense of hating it. And as increased or excessive alcohol use. It's another one of the manifestations of male psychological suffering, is to drink more. Part of what the culture teaches them. I don't think it's that men are failing to fit the appropriate self-descriptions of the diagnostic system or failing to present themselves as the issue. I think it's a limitation of our health system, of our diagnostic system. It has poorly conceptualized psychological suffering and despair, and doesn't really reach out to men or respond to what they need in a sophisticated way.
Okay, so you've given a lot of good information here, and I want to respond to some of it. It sounds like there's a problem of monitoring or quantifying the scale and the scope of men's psychological suffering, because, as you point out, men are less likely than women to talk about their problems. And in some of your writing and speeches, you've said when they do talk about their problems, they're often not well received, and they're told to just handle it on their own, or just be a man, the typical messages of stoicism, these things. So do you think that there's clearly a cultural element, but how could we do things better as individuals and as a society to address and recognize the silent problem that often is men's suffering?
Well, a really interesting context for looking at this is some work that I've been doing with first responders, specifically with paramedics, dispatchers in the emergency health services area, helping them to develop new approaches or resources for building psychological coping, resilience, and so forth in this traditionally male culture. It's mostly men, not entirely by any means, but it has developed to embody certain key aspects of male culture. And as you said, stoicism is a big one. So for a long time, you would have paramedics going out to situations that were just awful and incredibly stressful and overwhelming and painful. And they would often come in with a strong moral commitment to helping to resolve problems, to being there for people, and sometimes would be faced with situations that really didn't work out, that were just unfixable, that were tragic in nature. And this would create enormous amounts of stress on many levels. But the advice or the credo for a long time, as expressed in a slightly joking way, if you've experienced something terrible, get yourself a Slurpee and suck it up. Suck it up, absorb it, deal with it, forget about it, move on. It doesn't work so well for most people to simply say they can do that. There's been a pushback by first responders saying, that's not good enough. Just telling me to suck it up is not good enough. And it leaves me vulnerable, and it often leads to psychological harm and traumatic stress disorder, etc. So just telling me to suck it up is not good enough. We need something different. And there's begun to be a movement towards more helpful responses. Peer support programs have proven to be very powerful and have really affected in a positive way cultures of first responders, cultures in law enforcement, cultures in the military. Peer support programs, structured ways of having someone who understands your world, who knows what you've been going through, and can help you to talk about it, to make sense of it, to find ways to cope with it that are more positive and useful and effective. There's really been a change there, and those cultures are leading the way, I believe, within the world of men at work to change the culture for dealing with intense stress. And not just to say, go drink a bunch, go drink more, go get drunk. That's a way of handling your suffering. Remarkably bad idea, remarkably ineffective coping strategy, creates far more problems than it resolves. Mm-hmm. But again, that's starting to change. And I think what you now have is the development of increased access to peer support, helping men to make those interpersonal connections with someone they can trust, someone who knows what they've been through, who knows what it's like, and can help them talk it through and find other ways of thinking about what's been going on. So that men in those contexts are starting to develop the skills of sharing their experiences, sharing their concerns with others, and using what I refer to as collaborative problem solving to figure it out. So women have traditionally and are more skilled at connecting to others, at talking about what's going on, but it's not just to express their feelings. It's to solve problems, to make sense of things, to think about situations more adaptively, more helpfully, to take different actions, to learn from others' experiences. It's really a very powerful kind of problem solving that is done with others or in a group or with a close friend. It can be very helpful. Men have not been trained or conditioned to be skilled at this or open to this kind of problem solving and have suffered for it. I think that's changing. I think that kind of collaborative processing is becoming more common in men. And one of the ways I believe that we can help to build that kind of collaboration is by building on the male tradition of teamwork. And that's been, I believe, stronger in the male culture historically. It is expressed most clearly in the context of sports, teams, and working together and backing each other up and someone having your back, as they say, or in the military or paramilitary structures of our society. There we do have teamwork situations which give men a fair degree of support and validation and collaboration. But it is interesting that involvement in a team, in team contexts, tends to be peaking for men when they're much younger, into their 20s perhaps. But for most men, by the time they're out of that age range and they're into their 30s, 40s, 50s, they've often lost that involvement in a team context. They often don't have involvement in sports, involvement in other kinds of team activities. Sometimes work teams make up for that, but my impression is that's relatively uncommon, that men are much more likely to become more separate, more isolated, connected to their families, for those who have families, but losing that sense of peer support and teamwork. And I think that's a real loss. And it's really important for men to learn about engaging with collaboration and sharing and so forth. Again, as I say, I believe that's really starting to happen with the peer support arrangement.
Mm-hmm. That's a very interesting observation. And I think the way that you phrased it may be more receptive to a lot of men, because the traditional talk therapy where you go in and you have an open-ended discussion without much structure or clear goals or outcomes, a lot of men find that to be not a good use of time or not effective, and they just don't see the point. But I think the metaphor or the analogy of training and skills, which you've mentioned through your Antidepressant Skills Workbook, it's not just, philosophy. It's not something abstract. It's tangible daily skills. Here's what you can do to prevent and deal with depression if you notice the symptoms in yourself. That's a good way of putting it. And training is a word that I think all men can relate to, whether it's training for job skills, whether it's training for the military or training for sports. You have to learn certain skills and do repetitive actions, and then you get better. You build capabilities. And we could use that same lens for mental health. And I think that is something that would be more attractive to a lot of guys, as opposed to just tell me how you feel, that kind of approach.
And there was historically an approach to therapy which believed that what it was basically about was elicitation of feelings, identifying what you're feeling, and then expressing it, sharing it with the therapist was somehow going to make it better. But if you really got in touch with your feelings and you really express them, they used to call it abreaction, but that somehow this expression of feelings was an inherently therapeutic thing that was going to make you a much better person. I don't really think that's necessarily true. It is important to identify what you're experiencing, if you like, what your feelings are within, because it's a kind of a signal. It tells you if you're feeling horrible emotional responses, if you're feeling despair, sadness, if you're feeling anger, if you're feeling fear and anxiety, when you're feeling those things, they are alerts. It's like something on your car that beeps and lights up and says, there's something wrong here. You have to notice it. I sometimes compare it to a smoke detector alarm. I see it goes off. That's like a feeling. If I ignore it, that's kind of dumb, because it is telling me something important that I can do something about, or I should know about it. If I sit with my ear pressed closely to that smoke alarm, I won't just go deaf, I will have a horrible time, and it's also stupid. It's pointless. Just getting deeper and deeper into your feelings in itself is not that helpful. What is helpful is to say, what is this feeling telling me? If I'm really angry, what am I angry about? What do I believe has been done to me? What do I think I need to do about it? What are my options? So it says to you, I'm really angry. What am I angry about? And it may be, I feel in my workplace, my abilities are not being recognized, let's say. As you dig into it and really think about what's making you angry, that then opens you up to say, well, what are your possible options here? Well, I can leave this position. What are the pros and cons of that? Okay, pros, I lose the income, but I might have a better job. Or I can take action to be recognized where I work, etc. You can take someone to problem solving, to action that is meaningful. But if you ignore the anger or shuffle it aside or say, I'm just going to go drink a whole bunch instead, you don't really recognize the signal, you don't recognize or identify the problem, and you don't take the most useful and appropriate action about it. Same thing is true for other negative emotions. If you're feeling anxiety and fear, you want to be aware of this. What am I anxious about? What's happening here? What are my options? What might I do about this? If I'm feeling incredibly sad, when I really allow myself to feel this sadness or this sense of isolation or whatever version it takes, where's that coming from? Why am I feeling that? What are my options, etc.? You move it to problem solving. It can be very helpful to talk to another person, whether a therapist or just a person you really trust, and say, this is what I find myself feeling. This is what I've been thinking. This is what I'm telling myself about myself and my world. And your friend or your therapist might be able to help you see, perhaps, that the way you're talking to yourself may be unduly negative, unnecessarily gloomy or pessimistic or self-attacking, etc. And if so, develop a way of interpreting or understanding what's happening that is more adaptive, more accurate, more realistic, more fair, more helpful. And a lot of therapy is really about that self-talk, that interpretation, which may be leading to perhaps exaggerated or unnecessarily terrible emotions. But then it also helps you to say, well, yeah, there really is a problem here in my life. This is what it looks like. And then these are some options I might have to change it. So it can really open up the way you're thinking about yourself and your world in a way that is much more effective and more likely to lead you to a happier, more fulfilling life.
Mm-hmm. That's a very good way of looking at it. And I think you may have unlocked one of the keys to what I would consider a good and beneficial version of Stoicism. And I think that word is kind of, it can be a bit of a trigger for reactions by some people. Some people say Stoicism is unhelpful because it means emotional suppression or ignoring your feelings and emotions. But I think that's a poor interpretation of it. It's really about identifying your emotions and feelings and doing whatever you can in a positive and constructive and useful manner to address them without wallowing unnecessarily long in them. So as you said, skills, solutions, that's the focus, as opposed to woe is me, life is hard, I feel terrible. And I think that's how we can recover that term from some people's interpretation, which is merely don't talk about your problems, ignore your problems, and just hope they go away. That's not Stoicism for me anyways. For me, it is, okay, we have information. It's coming from our thoughts and feelings and our body and our mind and the world around us. How do we deal with this? What needs to be done? And what are the options?
And an aspect of Stoicism that's very important is the idea that you have personal values and you judge yourself in relation to those values. And when you're working in your life in accordance with those values, you feel a sense of honor. And when you believe you're violating certain basic values, you can feel a sense of dishonor, which needs to be addressed, because it's really a terrible feeling. It can be a kind of shame, experienced as a kind of shame over what you haven't accomplished or should have done, and so forth. But one thing that's critical is to understand that you're in a situation in your life, you experience certain emotional responses to it, but between those two, it's your interpretation, your thoughts, your cognitions, the way you make sense of your world. And Stoicism very much encourages an open and rational way of looking at where your feelings are coming from. What are you reacting to? And how are you talking to yourself? So cognitive therapy is all about understanding what you're saying to yourself that is then triggering the emotional response. Nobody reacts directly to a situation. We can only react to our interpretation of that situation. And if that interpretation is unrealistic, inaccurate, unbalanced, unfair, unhelpful, then our emotions will be inaccurate, unrealistic, and unhelpful. So it's really important to unpack what you may not even be aware of, which are your interpretations of the situation and yourself. So if you're in a situation at work, you've accomplished certain things, not accomplished others, and what you say to yourself is, I've totally ruined this. I've really failed. I'm fundamentally a failure. It's because I lack capacity or I lack ability. And that's just how it is with me, and I'm not really worth very much. And if that's, in effect, how you're talking to yourself, your emotions are going to be those of shame and failure and being a useless person, and etc. You can have very strong emotional responses. You need to go back and look at what you told yourself that led to those feelings. And then cognitive therapy says, let's have a look at those. Are they realistic? Do they fit what you actually know or the feedback you've received? Are they fair? Were you in a situation where there was no way of accomplishing the goals? Were you in a work situation where the goals were unrealistic, or you didn't get adequate support, or you were given a massive amount of work and you couldn't focus on any one task? Were there mitigating circumstances that should mitigate your emotional response as well? Are you judging yourself fairly? Is this helpful to talk to yourself about what a total waste of space you are? How helpful is that? Where does that take you? Does it help you to act more effectively? Or is a more balanced and fair way of evaluating yourself or even looking at a kind of exaggerated pessimism? This isn't going to work. This is going nowhere. This is going to be a disaster. Maybe you need to look at those and say, is that helpful? Is that a realistic way of describing the situation, or is it quite exaggerated? All of it changes your emotional response and will change your behavior, your action, your problem solving. So really getting in and understanding and looking at that process by which you go from a certain situation or experience in the world to an interpretation of what it means to you, to an emotional response, to therefore a behavioral response and an outcome. Really looking at that and looking at how it could be different. It's what my self-care workbook does. The Antidepressant Skills Workbook is all about those cognitive behavioral skills of finding a new way to think about, to feel about, and to act about your situation in a way that's likely to get you more helpful outcomes in terms of your own feelings, in terms of your experience, and in terms of affecting the world.
Mm-hmm. Yes, and we will put a link to your Antidepressant Skills Workbook here so that any of our viewers can go download it and read it. I noticed...
Worth noting that it's free, which has been a source of puzzlement for many others over the years who said, why don't you monetize this? And I said, the thing that rewards me the most is to know that large numbers of these workbooks are out in the world, all over the world, that 1 million people have downloaded this workbook in one of those 7 languages, that 300,000 got downloaded in China in the last year. I find that fascinating and extraordinary and one of my major rewards in the work that I do, but it has to be free to get that kind of wide dissemination.
Yes, and I'm glad that it is. So I'll encourage all of our viewers to go check it out. I want to turn now to the topic of what some people call deaths of despair. So in some of your previous videos, and one of them I will link in the description here, which is fantastic. I watched it again recently, called The Fentanyl Crisis, which was published on our channel 4 years ago in 2017. You were speaking about, particularly in British Columbia, where we have a very bad drug overdose problem focused around fentanyl. And as you point out, approximately 80% of fentanyl overdose deaths in Canada are men, as well as, unfortunately, 80% or so of suicides. And these could be examples or evidence of hopelessness, which is not registered as clinical depression under the DSM, but it's predominantly men who feel like they're in the narrow corner, as you put it. They feel like their life has got to a point where nothing is going well and nothing could go well, and they don't see a way out. They don't see options or solutions. So the only conclusion that some people draw is, this is the end for me. And whether they use a lethal method of suicide or whether they use, a way of that's an analogy or an alternative method, which is basically drugs and alcohol, trying to basically shut out the world and eliminate their own consciousness. They are both forms of deaths of despair. And as you point out, in the 40 to 60-year-old range is when it typically peaks in men. So what I want to ask you now is, how can men listening to this identify the warning signs in themselves and in other people? And when they see those warning signs, what should they do about it?
Well, the warning sign in yourself would be that sense of terrible suffering, what we call the 3 I's of suicide. There's a group in Seattle, University of Washington, who've written about this. It's really smart. 3 I's are the sense of intolerable pain, whether it's physical or emotional, that sense that this pain is interminable, that it feels like it's going to go on forever, and the sense that it is inescapable, that there's nothing you can do about it. It's a kind of hopelessness. Those 3 conditions, when they're experienced, can lead any of us to think seriously about suicide. And perhaps a third of the population will at some point think seriously about suicide at some point in their lives. The warning signs may well be that experience of your world where you may really tell you that you need to reach out, whether it's within the system, whether it's to a friend, someone you trust, whether to a peer support environment, if you have that, a kind of reaching out that needs to happen to get ideas or another perspective, because you may have gone so deeply into your own world that you no longer have perspective. You no longer see that there may be options. One of the complicated scenarios, and I wish there were a lot more research on this, is the scenario of men working in the trades who get physically injured and then develop pain syndromes. What had been done at one point tended to be prescription of opioids within the medical system. But over time, there was more of a recognition that this is a very addictive drug and it has risks associated and it's not a good idea and it can increase in dosage. So general advice within the medical system to cut back on that, to do a lot less opioid prescribing. My fear, my worry, is that it left a lot of men without pain control, left them in a sense of a kind of hopeless situation about the pain they were experiencing. That to me is a dangerous situation. Needed to be thought through more. We really need more research on pain management approaches, on rehabilitation approaches, what men can do, and what men can do to prevent injury, how they can physically take care of themselves and remain more physically strong and hopefully not be subject to those kind of injuries. So larger social problem that I think is relevant to suicide risk and overdose of opioids, etc., in terms of the whole issue of chronic pain, which I think is not dealt with that well in our society. It's not focused on enough. We need to learn more. We need to do more about that. And I think a lot of the victims are men because of the fact that we put men primarily into jobs that are physically dangerous. It's reflected in the fact that essentially all workplace deaths are men, 97%. We take it for granted, but it's very noticeable. We put men in physically dangerous jobs. They get injured or they die, and we assume that's normal, and men are taught to assume that's normal. It's something we need to really think about as a society. So warning signs might well be that sense of hopelessness, of interminability, of your suffering, a sense that nothing's going to make it better and it's just too awful to bear. They can be warning signs. Or it might be, again, a warning sign of your own emotional suffering might show up as being more irritable, being angry at people around you, or just feeling a sense of building rage. Those kind of things, again, can be warning signs that you really need to talk about this. You need to learn more about how to deal with this as well as possible. So those can be some of the warning signs. And hopefully a response could be within yourself. I believe in using those cognitive behavioral methods. I think they're pretty amazing, and they're the most effective things we've got for changing psychological suffering in terms of what an individual can do. So I think there's some real potential there, especially for men, in learning about and embracing and using those cognitive behavioral skills, joining in a peer support situation in a group of other men to talk about those skills and how to change situations.
Right. So it sounds like widening the view of the men who are in the narrow corner is a really important thing, both in terms of what their options are for individual actions, as well as the people and groups and organizations they can reach out to for connection, for help, and for integration, so that they don't have to deal with whatever pain and suffering they're experiencing on their own, but they can deal with it as a team, using skills and using strategies.
Mm-hmm.
I think that can be, a window out of their dark place.
I think that's true. And I don't think our society is doing incredibly well at responding to that. I think we could do a lot better. There's a lot of potential here.
Yes, there is. And on this point, I just wanted to jump off to point to a really good study that you did. You published a roadmap to men's health in 2010, which we will link as well. It's a very good read. I encourage all of our viewers to go check it out. So in this study, you looked at many different aspects of male health. The starting point is that life expectancy is shorter on average in developed countries by 4 to 6 years for men compared to women. This is given very little attention by public health authorities. And you pointed out in your study that despite this, there's very little funding that goes specifically towards male health. So in the US and Canada, a lot of the gender-focused health funding goes towards women. Between 2000 and 2005, men's health research received less than half the funding allocated to women's health by the Canadian Institute for Healthcare Research and the Institute for Gender Health. So some of the issues we've already talked about: suicide, drug overdose, workplace deaths. These should be seen uncontroversially as male health problems and given appropriate research funding and support money, but they're not. And it's unfortunate, and we can see the consequences. Have you ever, because you are a doctor, have you reached out to policymakers or people in the departments and ministries to make them aware of this and to ask for some change?
Well, one has conversations with people about these results. The reports are out there. I've spoken to people. Haven't had any formal involvement in what might be called the men's health or men's mental health focused interventions. But having those reports out there gets the ideas out there, and I really have optimistic hope that it sinks into the understanding. At one point, I was invited to speak for a radio interview at CBC about some advertisement that had gone out for a razor blade, and it was all about making fun of men, shaming them for being horrible, and saying, "Stop being so horrible." Mm-hmm. And the concept that was used, of course, was toxic masculinity. And I said, few things wrong with this. Nobody's ever defined this concept of toxic masculinity. No one has even felt the need to define it. It's treated as though it were obvious when it's anything but Are you saying that all men are in some way horrible? Why do you use the word toxicity? Men are poisonous in some way? Is it a small group of men who are poisonous? What's your point? How are they poisonous? What are they doing? You're using the word toxic. Why? Where did that come from? So that's one issue. The other is that shaming a group of people has never been an effective strategy for making change. And relying on shaming to think that you're going to create change is foolish. Flies in the face of an awful lot of experience in attempts to create behavior change in our society. Shaming, what's going to happen? You have, let's say it's somebody who's a violent guy, who's horrible in relationships, who really has those stereotyped masculinity perspectives that you find so awful, listens to this ad. How does he react? He says, this is ridiculous. I'm not going to buy that razor blade. Doesn't hear it, thinks it's stupid. Who's going to listen to it? Be much more balanced and kind and compassionate men who will listen to it. Some of them will feel, gosh, I really do need to feel some shame here for being male. How terrible to be male. Others will just say, why are you accusing me of this? That's not who I am. Where's this coming from? You can disrupt that conversation that's needed to actually create positive change rather than make positive change, and yet feel quite virtuous in doing it. So shaming, that kind of approach, not an effective way to go about it. Concepts that are vaguely defined in pejorative labels like toxic masculinity, not helpful, not the way to go about it. So that's been a way of trying to have an input to the way the conversation is going, the way action is being taken. And I think the men's groups, like the one you're affiliated with, are really a good idea because they highlight this other perspective. They say there's other ways to look at it. There are more effective ways to go about this. We need to establish connections and conversation and respectful discourse.
Right, exactly. That was the Gillette ad, which said basically, traditional male behavior is repugnant, and men need to completely transform themselves to be more like women in order to be good civil citizens. That was essentially the implication of that ad, and it was widely mocked online. And I think the company actually lost a huge amount of money as a result of it, which shows that this kind of misandry, we should call it what it is unacceptable to a lot of people. And especially when there's a double standard, they would never dare say the same message about women. In today's culture, could you imagine an ad which said, women, you're doing poorly and you need to change your ways? And, whoever made that would lose their job. They might go to jail. They would be sued, all these kinds of things. But somehow misandry, whether it's by corporations or governments or the media or entertainment, it gets a pass. And I think that's unacceptable. Actually, I'll be speaking very soon to an author, Paul Nathanson, who wrote a series of books on misandry. So I will look forward to that conversation where he explores why, how did this come to be, and what do we need to do about it. But yes, I agree with you completely. The label of toxic masculinity is not helpful. This kind of stigmatization of some innate quality it doesn't lead to a better world for men or women. And so that leads me to a question, which is, I can probably imagine the answer, but when you saw the APA, American Psychological Association, put out their guidelines for treating boys and men, where they said traditional masculinity is on the whole harmful, and when psychologists are treating male patients, they should tell them to change some of their masculine characteristics. What was your thoughts or feelings about that message?
Well, as you can imagine, I found that report to be surprisingly shallow. I was rather disturbed at the limited way it actually used or listened to research findings, an awful lot of pure, based on who knows what opinion was in that, and that opinion itself was well, I might say somewhat toxic if I really had a clear definition of that word, but not likely to be therapeutically helpful, not an appropriate approach. It was patronizing in the way that's traditionally applied to men, but it had that quality of denigration, of contempt, of disrespect for an awful lot of men. And reading that as a male, I'd say, I'm not going for therapy. I don't need somebody judging me and talking about me in these incredibly judgmental ways. Forget about it. So therapy only works. The therapy that I do only works because I begin from an attitude, from a position of respect. I was once asked by a graduate student, how do you establish a therapeutic relationship? And I said, you see what it is in that person that is extraordinary, that is admirable. And the gift of seeing what in that person is admirable and amazing is part of what makes it possible to even have a therapeutic relationship. I won't diverge into that, but the attitude, the respectful attitude needed to help someone achieve positive change is not what was exemplified in that report. And I thought someone following and listening to that report would be less effective and more harmful overall.
Mm-hmm. Yes. So I just wanted to ask you a bit of a question on the side, since we've spoken about a lot of good issues, but in some of your writing, you point out that men are more likely to engage in risky and aggressive behaviors than women. Some of those are dangerous to themselves, dangerous to other people. And you've said that there's a cultural aspect to this. Men are encouraged to be a little bit more extreme and to deal with problems on their own rather than seek help. And, dangerous driving was one of the top 3 causes of lower life expectancy in men, motor vehicle accidents in your report from 2010, as well as suicide and cardiovascular disease. And I think the extreme way in which some men live is partly explanatory of their lower life expectancy. But I was just speculating, is this because of culture? Is it things that we tell ourselves or things that the world tells us how men and women should be? Or could there be an element of evolution in there? Could they be evolutionarily evolved responses to our environmental conditions? And I'm thinking specifically about sexual selection and dating, because a lot of data and anecdotal evidence and personal experience from men and women is that women are very selective. They're very picky about who they go for. Men are a little bit less selective in women. And it's widely believed that women go for the highest achieving, sort of top tier, top of the social ladder men. So is some of this aggressive male behavior, the dominance seeking, the competition, a desire to rise up in that hierarchy, to have a wider mate selection and be attractive to women? Because a lot of the average and less than average men are just completely ignored. Like they don't get dates, they don't get attention, nothing. And for them, from a biological perspective, that's like the end. It means the end of your bloodline. If you can't reproduce, if you can't make children, if women don't want you. So this is just kind of a out of left field speculative thought. But I've thought that the extreme male behavior, which is obvious to all of us, is to get to those high positions where you can get what you want. Do you have any thoughts about this?
Well, partly it becomes complicated because of the way we interpret research. Research findings are generally based on a comparison of means, of averages, to look for statistically significant differences. And they typically ignore the subgroups, the clusters within that group. They just want the overall mean. Looking at overall means is really problematic. It tells you something, let's say about a therapeutic method or about difference between males and females, but it ignores the extraordinary amount of variation within each group. So if one looks at a lot of variables where men and women on average are different, you'll find there's more variation within the group, within men and within women, than there is variation between men and women. The average may be significantly different, but you cannot ignore the subgroups. I don't think there's one male culture. I can talk about it on average in general. I think there are subclusters of men. There are many kinds of men. I've grown up as someone with none of that traditional masculine value stuff. I, don't watch sports games. I've never had a beer. I don't like a lot of those things men are supposed to like, the power stuff, the risk-taking. I find it incredibly irritating and boring and trivial, personally. The women I've been involved with have never been looking for that kind of traditionally risk-taking, searching, fighting for the top kind of guy. They would find that kind of guy a tedious bore. I've been with women who are looking for intellectual ability and expansiveness and imaginativeness and creativity and appreciation of art and music and so forth. I've had male friends whose primary value was something like loving comedy and music and intellectual advancement and knowledge, rather than that model as one type of male. So we really need to do, I believe, what's called a cluster analysis of men and talk about the kinds of men. And then guess what? The kinds of women. Because women are not homogeneous. They're not all the same by any means. And I think we need to not use those male-female split in that overly simplifying way and miss the point of the immense complexity of what's going on within each of those groups. We need to also step back from those group averages and so forth and get into the subgroups, the cultural subgroups among men. Makes it a more interesting approach. In my world, I don't know about all this, biological determination that we're trying to rise in some kind of power hierarchy, etc. I don't know if that's true. I think historically there would be very different qualities in men that might be, if you like, effective or selectively helpful in an evolutionary perspective. I don't think it's as simple as that. Mm-hmm. Men who were very good at growing food for a long time would have been the kind of special skill that would have made them a wonderful mate and preferential. Only within certain kind of versions of a political hierarchy do we say men should be rising to be the top, to be the leaders. I think it misses a lot of the complexity of what's happened in an evolutionary perspective.
Mm-hmm. That's a very interesting response and not what I expected, but that's good. I think you've made me think about things a little differently. It's not just one singular hierarchy, but instead of being better than the guy next to you, maybe you can be different, and that can be an alternative strategy to do well in the world. Yeah. Mm-hmm. I wanted to ask you, because I think we're coming gradually towards the end here, how can we, as a society, take a more positive view of masculinity? I think that when we look at how the media and culture deals with men and women as men and women, there isn't very much positive that it says about men nowadays. We get blamed for a lot of the worst things in the world. We get blamed for wars and climate change and pollution and violence and all sorts of different things. But we are also not celebrated for all the achievements and successes and contributions, the tremendous things that men have given to the world, the civilizations they've built, the science and technology, the inventions, the culture, etc. So I think it's skewed in one direction. But how can we look differently and see uniquely male characteristics in a positive light?
About 5 years ago, I was asked to give a talk for a firefighters foundation charitable group. They do a yearly talk about things that would be related to first responders. So I gave this talk at a Surrey City Hall, and I said, let me see. And I'm facing an audience, which is most unusual for me. There's an audience filled with police officers and firefighters and paramedics. They were these incredibly tall and strong and determined individuals in uniforms I would never have given a talk to. They would never show up at a psychology conference. So I thought, this is fascinating. So the talk that I developed was one where I made a broad point. In addition to talking about the psychological risks and damages and harms of first responder work, I also talked about the kind of values that enabled someone to do this extraordinarily valuable, this critical work, the value on honor, on doing something that is helpful for your community, the joy of helping someone else, of saving a life. These were the powerful motivators for these individuals doing these risky and difficult and scary jobs. But my later point was, let's also put this in context. Let's put this in the big, big context of climate change. So I put up a little slide. This is years ago. I said, look, there's the wildfires each year in North America. Look at that line. Look how it's rising. More and more and more brutal, dangerous wildfires happening. This is obviously the way of the future. And I could have put up something similar for floods and other climate change related things, obviously increasing and about to be increasing at an astonishing level. Who do we turn to when we're facing these kinds of terrifying and rapidly rising dangers in this world we've made? Who do we turn to? We turn to first responders. We turn to firefighters. Large majority are men for various reasons. We turn to paramedics for rescue. We turn to other emergency responders for floods and other kinds of disaster. We look to traditionally male groups and workers, not only, and increasingly both genders participating, but we look to groups that embody the valuable qualities of masculinity, the qualities that have been linked culturally with being male, the stoic values of honor, of self-sacrifice, of working for your community, of supporting your family. These are the things that have primarily driven men through history. And these are the things that have informed the whole first responder world. And increasingly, we are going to rely on emergency response, on the kind of traditional values and behaviors and goals that are associated with masculinity more and more. We need to value those. We need to honor them. Because if my house burns down, I want first responders to be coming who embody those values of honor and self-sacrifice and working for the community and supporting the people around them and being there to keep people safe. I want people there who have those values, and I honor those values, and I admire courage. The most wonderful of those traditionally masculine values, it is honorable. I admire it deeply, and I rely upon it. And I will so increasingly. So in my view, we need to understand the positive values, the qualities, the abilities that are associated with traditionally masculine culture and truly respect them and truly value them and not act like they're irrelevant to us, because we are all going to be increasingly reliant on the people who are able to rescue us from what's going to be happening. That's what I think.
That's an excellent way of putting it. Thank you very much. I think that's a perfect place to close off with this positive message. Dr. Bilsker, where can people find you online if they want to learn more about your research and your practice? I know you have a website.
Well, I do have a website for a small consulting group I work with a colleague, Dr. Merv Gilbert, and we have a website, a little company called Vancouver Psych Safety. And what we do is help organizations to put in place interventions, measures, and so forth to understand the psychological health and safety of their group, just as they've always worked with physical health and safety, to measure that, to put into actions into place. It's something we've worked on a lot, and it reflects the work we did with the paramedic group, developing a tool to build resilience, psychological resilience, a self-care tool. We have all the other self-care tools up there for free download, and that's on the site. So it's Vancouver Psych Safety, and I guess it's www.psychsafety.org is the website. But it's one place to find some of this work, some of these ideas.
Excellent. Well, I will put the link to that as well. This has been an absolute pleasure. Thank you for sharing your knowledge and your wisdom with us, and all of these messages. It's been a tremendous conversation. So thank you, and I hope we get a chance to speak again in the future.
Thank you very much. Thanks for having me.